right, while our panelists come up, let's put up your next question that should still be up on your phone. And your next question is, in general, how have relationships between UCSF and our local communities been impacted by changes in federal policies over the last 6 months? Oh, yeah. Yeah, please do. Thank you for being here. Thank you for being here. Thank you for being here. I'm really excited to hear from you guys. Okay, it looks like we have some problems to talk about, at least for 47% of the people in the room, so I'm looking forward to this conversation. So our panel presentation this morning is titled Current Challenges, Field Reports from Research Teams with Threatened Federal Funding. And our goal with this panel is to set the stage for us in terms of some ways in which community-engaged research has changed over the last 9 months. I'm honored to introduce our 5 panelists today, and maybe each of you can just give a little wave. I'm doing very brief introductions in the interest of time. The 5 panelists represent 2 research community partnerships, and we have represented on the panel today both someone on the research side and someone on the community partnership side. And these 2 teams have both experienced NIH cuts, delays, reappropriations, and other craziness over the last couple of months. The first team includes Anjana Sharma, who is an associate professor at UCSF in the Department of Family and Community Medicine, with expertise in patient and community engagement in healthcare settings to improve quality and safety outcomes. She is joined by the 2 co-directors of the San Francisco Tech Council, Andrew Broderick and Karla Suomala. The SF Tech Council is dedicated to bridging the digital divide for older adults and people with disabilities. The second team includes Neeta Thakur, who is professor at UCSF with a research focus on social and environmental stressors on asthma and COPD. And she is joined by her community partner, Gustavo Aguirre, who is Director of Climate Equity and Environmental Justice for the Central California Asthma Collaborative. So, that was a lot. To start us out, I'm just going to ask each of these panelists to set the stage for us in terms of your partnership, its grant funding, and how things have evolved in particular over the last 9 months.
Okay, so Gus and I will start. So we have been partners for about 4 years now, brought together through an opportunity from the Environmental Protective Agency, or EPA, to study the impacts of wildfire smoke across the state of California. In that work, we proposed to co-develop a survey with additional community partners in San Francisco, Richmond, California, and Fresno, and distribute that survey to understand priority health concerns during wildfire smoke events, and then barriers to resources that are known to protect oneself during these extreme events. Unfortunately, back in April, our funding was terminated from the EPA. After consulting with Gus and our other partners at Berkeley, we had the opportunity to take part in a class action lawsuit to get funding reinstated. And happy to say that that effort to date has been successful, and we did have our funding restored. In July, late July, and then reset up here at UCSF maybe a few weeks later, and are currently in the process of re-establishing terminated subcontracts. And so I think Gus, maybe just briefly say how that's delayed some of the work that we've had planned for this summer for the surveying, and also just like its interruptions to our community partnerships.
Definitely, thank you. Good morning, everyone. Buenos dias. I definitely think that like the reaction to this from our community partners. Unfortunately, it was like one delayed, but also not a surprise. We went through this in 2016 when there was a lot of EPA funding cuts during Trump's first administration. And so when Trump was reelected this time around, we're like, what's going to happen to especially our environmental research grants that come directly from the federal government? And we saw that. We saw the aftermath of that. And really connecting with our community-based organizations this time around was not as difficult as we thought, and thank God, because a lot of the community-based research that we do really relies, as you saw earlier, on fundamental community partnerships and community leaders in that. And so it was really taking a pause, taking a deep breath, and hoping that folks would take action, whether it was through private philanthropy or whether it was reinstatement of the funds. And so it was really kind of just touching bases with the organizations that we had worked with, assuring them that, one way or another, we were hoping that this research would move forward. And thankfully it did. And I think the trust building emphasis in this was making sure that we stay connected with those community-based organizations and work with them through different pathways, whether it was, data collection, through existing outreach events, or through, their own events. Oftentimes in the Central Valley, there's a lot of environmental justice-centered conferences, and we really took the opportunity to do what we would have been doing funded through our community-based organizations. And so although the work did slow down a lot, it didn't stop by any means.
Good morning, everybody. It's great to see a lot of familiar faces. So I wanted to talk a little bit about the story of the idea, because I do think part of this is science that comes from ideas and solutions from the communities who are directly impacted. And so we at the Activate team, and I see some of the Activate team, hey. So Delphine Tuo and I were really, in the trenches during the COVID-19 pandemic, remember that? And we saw that there was this huge widening of digital disparities, access to telehealth, ability to get a virtual visit. And we also saw a lot of assumptions about which patients would or would not be able to do telehealth, and those seem to have also some sort of biases and assumptions and racial stereotypes sort of built into that. And then we met with the COVID PCAB, which many folks in this room helped to convene, and we also were meeting with the patient advisory councils at the San Francisco General Hospital, so also wanted to give them credit as well, because we were really sharing the data with them, showing the ethnic and racial disparities with them around utilization of digital health access. And the solution really came, we really presented the problem. It was like, what are your ideas about solutions? We thought about this, that, and the other, and the group kind of together really had a consensus that they wanted a community health worker model that also was able to support patients where they were at to be able to access telehealth to the degree that they wanted to. And so I just wanted to share that because we were really proud of the idea and we don't know what's going to happen long term. And then that led us, thanks to Courtney Lyles and Elaine Kung, connected us to Andrew and Karla and the SF Tech Council. And I just wanted to ask, so a lot of times you hear, oh, our patients don't have phones, or oh, our patients don't have Wi-Fi, so they can't get this. How many folks here knew that you could get a free or really cheap discounted smartphone from community-based organizations in San Francisco? Yeah, I mean, maybe like 20%. I mean, I did not know. We did not know. So I think just working with Andrew and Karla really kind of connected us to the digital navigation work that was happening in parallel, kind of in silos. And so, yeah, I'll pass the mic, sorry, to you. But I was just really excited about how this idea came to be and how it really came from folks who were experiencing it.
Yeah, no, good morning, everyone. My name's Andrew with the SF Tech Council. Just a little context. SF Tech Council is what we call a multi-sector collaborative. So we're not just one organization, but we're a kind of multi-sector kind of model of organizations. So we're the kind of connective tissue that brings them all together on this very issue of digital equity. And I think, you know, for us in 2024, there was so much expectation and excitement from a supportive policy and funding perspective about what could be done in communities to close this digital divide. And for many of you, you probably know, like, the digital divide is now referred to as a super social determinant of health. So the partnership with UCSF was a very natural extension for us in terms of the work that we were doing to really address some of the social and economic outcomes. And I think, the years that we had through this grant funding, I think were very kind of constructive in terms of the resources we were able to put in place to support your projects.
And I guess just what happened was, we were funded in the fall of 2023 for 5 years. Delphine and I got back from vacation in June to learn that as of May 31st, that the funding had ended at the end of year 2. And at that point, we were encouraged not to pursue a lawsuit, and I don't know the reasons on that. Delphine really leveraged a lot of discretionary funding to kind of keep the team afloat, and then we had to pause everything, call patients. The patients who were receiving coaching and digital navigation, their main response was, "I'm sorry." Like, they were just so sad for us, and it was a really emotional time for our team. And then with the lawsuit, which may be thanks to your team, right, that we got reinstated as of the end of July. And so we have started back up. We have funding supposedly for year 3 out of 5. So our goal is really to do as much as possible in year 3. And I think just my takeaway is it's just waste, waste of time, waste of staff, waste of energy, loss of sleep. And then really, and not feeling like we have this, like with our relationship, we know is going to continue. That being said, it feels really bad to come to like our community advisory board and say, "Oh, we're off. Oh, and actually we're on. Oh, actually we're on, but we don't know if we're going to stay on." So we are committed to the relationships and committed to the work. That being said, it feels like the waste is the point.
Can you talk to us for a minute about the decision to pursue a lawsuit?
Yeah, as much I could say that we are the reason for yours, it is actually the APHA versus NIH ruling that helped reinstate a lot of the NIH funding across the U.S. and a big testament to our California Attorney General for being part of that case and advocating for us as researchers. So the case that I was involved with is actually one that is a grassroots effort. So I'll just comment and say the UCSF and the UC system are doing a lot of advocacy at one level, and this was an opportunity that came to me to feel like I could do something at my own individual level and also with our team's support as an individual faculty member when for those of you that have felt or have had terminations, it's probably the most disempowering feeling you could have as an investigator. You feel lost, you feel like you're not doing good science in the perception of some people in this country. And so this opportunity felt really empowering, not just for myself, but also to be able to take a stance against what was going on. And so it was an effort really led by Claudia Pulowski, who is a faculty member at Berkeley in the School of Law there. And she brought us all together, has a lot of experience in class action lawsuits from the environmental justice lens, and was able to build a representative class for all UC investigators. And it's against the EPA, the National Endowment for the Humanities, and also the NSF, the National Science Foundation. And they just added NIH, Department of Transportation, and I'm forgetting the last agency, but that's a huge deal for everybody. And so far, the first appeal that went to the Circuit 9 judges, so it's a 3-panel judge, is keeping in stay of our grants being reinstated, and there hasn't been another appeal to take it to the Supreme Court. So that's just the current state. But it was really just a way that I, as an individual investigator, and then also with knowing I had the support of all of the investigator teams, including CCAC, felt empowered to be able to take part of it.
Yeah, thank you. I think, like, you lead by example, right? Oftentimes in the environmental justice world, I come from, previously the speaker showed a map of California, and there's a big red circle in the middle. That was Kern County. That's where I'm from. I drove up from Bakersfield last night. And so we suffer from many, many layers of disparity. And one thing we always get from our elected officials, whether it's in Sacramento or in Kern County, is, well, if the air's so bad and you whine about it so much, why don't you leave, And we're used to fighting, right? We're used to, like, not giving up. We're used to making sure that we partner with folks that have some backbone and are willing to fight. There's many times where, research institutions have parachuted in, collected their data, and taken off, and residents are like, so now what, right? And I think in this longevity of, like, we don't leave, we fight. It was really refreshing to know that there's folks out there that will, like, stand their ground and fight, right, for frontline communities and environmental justice adjacent communities. So it was refreshing, to say the least.
When we talk about community engaged research, so much of our time is spent talking about relationships and relationship buildings. Can you guys reflect on how your relationship has changed or evolved over the course of the last couple of months?
I think it's interesting. We have, over the last couple of years, developed a really strong relationship with Anjana and the team, Activate team, and we've really learned a lot from each other. And so I think a lot of it in the last couple of months has been just a lot of uncertainty in the same way you described the experience of the cabs. It's like, are we on? Are we off? Do you need us? Do you not need us? Should we continue? Should we stop? And I think for all of us, it's just been frustrating. In the meantime, we've been also, all of us, thinking, can anybody else fund this? Do we know anybody who's got some money? Just a couple million. And trying to think about alternative sources and kind of grasping at straws to do that. So our meetings have turned from often, and when we get together, have turned from content in terms of helping focus on this really important study and making sure people are connected and have the skills to get the kind of healthcare they need, talking about long shot funding opportunities, which for all of us is kind of out of our wheelhouse.
Yeah, I'll just give you an example. Like, we did kind of jointly apply, but, we weren't accepted on a LOI because there were only 4% of the applicants that they could fund. So it gives you a sense of, oversubscription in terms of kind of current funding availability. But we, the Tech Council, we were talking to a foundation for some of our patient portal work, and they came back and they really wanted to know about how is this going to benefit the participants economically. So we try to lay out an argument about direct costs to them in terms of no transportation, no caregiving costs, et cetera, indirectly prevent, ER visits or hospitalizations, and et cetera. And they told us that it didn't meet their criteria in terms of wanting to fund a digital health intervention around older adults. But they were only looking at it from one dimension, which was an economic dimension. So we will continue to look for opportunities and partnerships, but I think the funding environment makes that very challenging for us at the moment.
And I would say, we are seeing, we see opportunities of, hey, what about this, what about that, coming through, in our research networks. I would say we're getting more ideas and tips from your team. So it's been really mutually, it's like peer support. At least for me, it feels like peer support.
Do you guys want to weigh in on as well on how tight budgets have impacted your visions for your ongoing relationship?
I'll start. I think what the biggest impact is that we were set to so part of our work was to partner with additional CBOs in both Richmond, California and in Fresno, California, to revise a survey that we had done here with 7 CBOs on trying to understand climate impact and resources access during both heat and wildfire smoke events. And we had just built up those partnerships in both Fresno and in Richmond. So in addition to working with Gustavo's team as a co-investigator and a member of the research team, we had also partnered, I think in total, with 7 additional CBOs. And we had just revised our survey based on their feedback about what the local needs were. And we were going to do 2 more meetings in both settings to understand the distribution plan and then also start surveying. But with this cut, we had no way of providing additional compensations to those CBO partners or for participant compensation for the survey. And it was ready to go in June. And this all happened in April. And so we had to stop all of that work that we had built up for and had a lot of momentum around. And that was really, really hard. And as a team, we thought that it would be better to stop that work now than run out of funds and not be able to compensate our partners, our additional partners. And so now we've had to rethink our plan because while our money has been reinstated, we were actually in our 3rd year and last year of our grant, and it ends November 30th of this year. And so now we're in the part of scampering on how to get all the contracts reestablished and then also rethink how we're going to engage our partners. And we have already, most of them are all on board, but we had to rethink the timeline for engagement and also for the survey distribution. And so it's just the mental math and the gymnastics that we're playing throughout this period that's been really, really hard. While also trying to seek similarly additional funding as something that might be more secure over time. And it's just really hard and disheartening to actually say that the federal government is no longer a steady stream of funding support. I don't know if you want to add.
I would just say, it was frustrating and very impactful. I think when the day we got the news, we had a 4-part series kind of workshop to work with community-based organizations. We had taken care of one. The day we got the news, we were set to that evening to have our second one. And so it was an email and a phone call saying, "Hey, are you prepared for tonight?" It's like, "Hey, guess what? We had to have a serious conversation about our future moving forward. At that point we had no clue what was going on. We just heard everything coming down from DC, and we're just like, for now it's a dead stall. And so reconnecting with them again and saying, "Hey, guess what? I think we're back on board." They're like, "Awesome, let's do it," right? And so it does, tamper a little bit the folks' spirits, especially when you're doing community-faced work. But to re-engage it really is energizing. But yeah, I think the bad news also, it weighs heavy sometimes, yeah.
I'm going to ask another question or two and then open it up for audience questions. So please feel free to get your questions ready. Karla, would you like to add?
Yeah, I just wanted to add a little further dynamic on the community side in terms of when we're looking at funding for research. There's also the precarity of all these community-based organizations and nonprofits and their funding streams. The Friday before the inauguration, we received word that we had been recommended, not just the Tech Council, but 28 community-based organizations and nonprofits, primarily in Alameda and San Francisco counties, but also in Contra Costa, for a $12 million 4-year grant towards digital literacy of underserved populations. That has since also been just pulled out from under us. So federal funding, state funding has also been limited. And then if we take a look at San Francisco City and County, as you know, their budget woes are very, very challenging. And so a lot of our community partners are cutting staff and trying to rethink what is essential in terms of essential services. Do you provide a meal, or do you help them get onto their patient portal? Or these are some of the choices, but it's really an unfair kind of choice in terms of what is an essential service.
And a lot of them in San Francisco depend on city budgets, and we all know those are kind of in large deficits for the next coming years. So there's like 15% cuts to their programs, which means the nonprofits, as Karla said, are kind of resource constrained, cutting staff, cutting programs, etc.
So my next question is to Karla, Andrew, and Gustavo. What can UCSF and its investigators do during this time to help maintain trust with our community partners? What are your expectations of us right now, and what are your hopes for the future?
Yeah, I would say, continue what you guys were doing. I think once we learned that the funding was cut, I think the first thing we did was we scrambled together and got a meeting and say, okay, who has money? Who knows folks that have money? How can we, look for private philanthropy? And I think there was a small cohort of individuals that came together and suggested philanthropy and organizations to potentially step in and supplement some of the funding. So I think it's really using the connections that you have at those moments. I think there was some submittals or potential applications that were sent out, kind of feeling like, is there any possibility? I saw the Robert Wood Johnson Foundation. That was one of the folks that were like, hey, we're here. But it really is the potential access to capital that is already so hard for nonprofit organizations, especially community-based organizations. So leaning on folks to have that experience, that expertise, and that knowledge of who to go when stuff like this happens, I think those connections are vital and essential for community-based organizations to thrive.
So if Neeta came back to you in a year or two and wanted to do another grant with you as a partner, you guys think you'd be in?
I'll be like, let's do this. Yes, of course, of course.
I'm happy to hear it.
One of the things I want to think about in this time of major disruption, and this is a good place to think about this, take a look at the bureaucracies involved. We've got government bureaucracies, we've got an academic bureaucracy of UCSF, and then you bring healthcare into it. Can you think of anything with sort of the Bermuda's Triangle of regulation and basically inertia when it comes to change? This is a moment, I think, however, where we do need to change how things are done and not just sort of shore up the structures in place. How can we be, and I used to be an academic and we hated this word, more nimble or when it comes to these kinds of opportunities? Our risk in terms of not rethinking our structures and the way we create partnerships is that academia becomes irrelevant in the question, and people and society as a general, not just these partnerships, continue to lose loss of trust among patients, among the general public. And so I think it requires some soul searching on the part of all of us to think, okay, how can we do these partnerships even though we can't do them in the same way we have in the past?
I would just add to that, I think, the issues remain, the problems, challenges are still there. I think from our perspective, we will continue to explore opportunities to partner and collaborate because there's certain skills, resources we lack on the community side, like research capacity. And I think one of the things that we need is also to build better business cases for funding to come into communities if the federal or state budgets aren't facilitating that. And so kind of having that research capacity to show what impact, interventions around telehealth can have in terms of improving health outcomes really help all of us. And I think that's an area where we can benefit more. So we'll continue to look for those opportunities.
Let me open it up for questions from the audience. And no,
add one more comment. I think one thing that Gustavo mentioned, but I think I'll just iterate, is that we continue to meet as a team, all of the partners, even during the period where there wasn't any funding, to strategize, and then also to think about, well, if this opportunity doesn't come back to us, how do we want to reshape our idea for a new opportunity, and what are the most critical things that we want to preserve from this work to help move forward? And I felt like it was very important to maintain the line of communication no matter what. And so we were still meeting every 2 to 4 weeks throughout the entire period. And so that I just wanted to add that. It's the maintaining the lines of communication and then transparency about any information that I had. I would immediately push forward, bad, good, whatever. Even if it was super uncertain, I'm like, I don't know how to interpret this, but this is what I'm learning, so this is what you're learning at the same time.
Questions from you guys?
Thank you for a fascinating discussion. One of the comments that stuck with me is the digital divide is considered a super social determinant of health. And as I'm thinking of cuts, we're often cutting people, and we're looking towards more technical solutions, which make sense under the circumstance, of course, and we need to do that. However, one of my concerns about that is as we move towards surveys that are sent electronically but not delivered in person, or solutions through MyChart rather than maybe a social worker sitting with a patient, my concern is how do we think about that digital divide where our most vulnerable patients who are least tech savvy can continue to access that information. And somebody said measuring is really important. Well, if our measuring tools don't even capture those needs, what do we do about it?
I guess I would start out saying more tech means more people, regardless of what we hear about AI. It honestly does. Training an older adult to use the patient portal takes about 2 hours. And that's just initial use. It cannot be done by a robot. It cannot be done by video. It cannot be done by PDFs. It requires a live human person one-on-one to do this. So I think that some of it is not about tech for tech. It's about tech because there is no other way for, when we look at older adults and individuals with disabilities, for them to contact their health care providers any longer. What they tell us over and over is they don't pick up the phone anymore. There's no phone. So the only way that they can get in contact with their health care providers and to have regular contact is through this. But yeah, in terms of, I think this is not about the super social determinant of health in terms of having tech replace people. It's about helping people do the very basic things that they used to be able to do without tech. I don't know if you saw the Chronicle this week or New York Times, Social Security is no longer sending checks. They will be put in bank accounts. This is beyond what you and I are able to do. So tech is critical.
Yeah, and I mean, there's a couple of kind of entities that are not in this discussion, which are health plans and healthcare providers in a more formal sense, like the Kaisers and Sutters. And, what are they doing to support their patient populations? We don't see a lot of activity coming from the health system side. CMS had a requirement that Medicare Advantage plans had to do digital readiness assessments and then have a plan to support their patients if they needed devices or training or whatever support they may have needed. So I think there's much more that needs to be done. And I think, engaging health plans or engaging providers in this discussion to support the community organizations and the people that they can put in place, to deliver the training, as Karla said, because it is resource intensive. It requires patience, it requires understanding. What we find in our work, it's not like people can't learn skills, it's just they need the confidence and they need the support and they need that kind of empathy and understanding as they're kind of walked through the training and other resources.
Can you say a word about what we mean when we say a super social determinant of health?
Well, for us, I mean, it's so critical to do anything today. And so when we see your first speaker talked about place being important in terms and looking at health disparities. Well, we also talk about digital inequities, and when we look in kind of neighborhoods of San Francisco, we see certain neighborhoods have kind of less performing and more expensive internet service, which they cannot afford relative to the household income. But many people, for education, for work, for healthcare, and say taking an aging population, all government services are online. They have to be able to go online to navigate those government services, and then they have to fill out forms and applications. And in that way, a lot of people are facing barriers because we learn through our work, a lot of older adults don't have a social support network. They don't have someone they can turn to and say, can you help me with this? And so where are they going? They're going to the library, or they're turning to their housing residential services manager. That's not their job, and they feel very uncomfortable when they have to handle a lot of personal sensitive data, and they don't want to do applications because they feel if that is denied, it'll come back to them as, like, well, you'd help me and I didn't get, the support or services I needed, so.
We'll move the microphone to the next questioner while we let Karla weigh in on that as well.
Yeah, in terms of some of the kinds of things, I don't know, since the pandemic, with this revolution in technology, you cannot get, as Andrew was pointing out, food benefits. You cannot get housing. You cannot get there are no Social Security offices. These are Medicare, Medicaid. If you can't get those offline, where do you go, right? So I think that those are essential and sort of that super social determinant aspect.
Okay, I'll ask another question. Thank you. This is a great panel. Karla, I wanted to ask you to maybe elaborate on the point you made, which I think is really critical, which is that that bureaucracies need to be more nimble, to use your word. What does that look like for you? And are the principles of community engagement central to that? Is that one of the ways in which we, as you said, make science more relevant for society?
I wish I could say more about, and I don't know exactly how they work, but I'll just give an example in terms of getting a grant. So when the Tech Council gets a grant, or any of the organizations that we work with get a grant, they take about 15% for overhead. That's it. Often less, because many federal grants don't allow more than 10 or 12%. So we get these little grants, and we are so scrappy. We are going to every last dollar to get them. When we partner with organizations in terms of research institutions, and that's anybody, this is not just UCSF, there's typically a 40 to 60% take from the institution. It's a huge imbalance in terms of when you're working right alongside a community-based organization where your partner is getting paid probably about $32 an hour. So there's this huge kind of thing, and also the speed that these take to work through these very, very large organizations. Are there ways to restructure these research grants in ways that can make them faster in terms of meeting the needs that are out there, and that create a more equitable relationship between the community partner and the research institution? If I had an answer for that right now, that would be awesome, but I do wonder.
I'm sure Neeta has ideas also. I think we've talked about this. I think, why does, we have now community partners can be part of RAP grants and be co-Is or co-PIs on RAP grants. Does a RAP grant need to have the NIH format, especially if the NIH is literally crumbling right now? Does it need to have that cumbersome structure? I'm going to say the payment piece. Could the payment piece be more nimble? Could there be a portal where CBOs and faith-based organizations, you register in a portal and you do the contracting in a seamless way rather than every department having their own weird P-card system? So I think even just simple things like in internal, these small but meaningful amounts of internal funding, could those be smoother? And payment and contracting, could that be smoother? That is within our locus of control.
Yeah, I'll just add, I do think some of this responsibility lies on us as investigators to ease the processes for our partners and also be smart in doing the budgeting with our partners. So I 100% agree with you on the inequity for overhead and indirects. And so when I'm building a grant partnership and looking at that piece, I remind them that supplies should be added. Like all of these things that we count as directs at UCSF are often indirects for our community partners. So remind them, hey, we could add this to your budget, and we can add this to your budget. And I understand that that's a cost to me, and maybe I can't get the project manager that I need for my team, but I would rather have our grants be more equitably distributed. So there are things that we as investigators should really understand about what are direct costs that our partners aren't seeing and make sure that they get those on their budgets, just like we put them on our budgets. And then the other process is the IRB reliance piece. And I very much appreciate our reliance team here, but there are huge hurdles when you're really wanting to do partnered research, and I am trusting Gustavo's team because they have years and years and decades of trust in their community. They should be doing the consenting, they should be doing the servicing, the surveying and the procedures, but it is a huge delay of time, and we definitely need to make our systems more nimble, and am an advocate for that in our own system here at UCSF, and will continue to be.
Yeah, and I think the only thing I would like to add is like when it comes to working with nonprofit organizations and CBOs, we have seen some traditional research institutions be less nimble than others. As we talk about these like economic downfalls from the federal government, like we were part of a multi-year, multi-million-dollar research project with LB&L to look at direct air carbon capture in Kern County, as it was something that was highly funded by the Biden administration. And so when that was pulled, we later found out that a lot of our partners, research institution partners, got paid, and there's like, well, sorry, there's no money for the community-based organizations, and if there is, it's going to be very little, And so that versus this relationship is like night and day, right? And so then you look at research institutions moving forward, is like, maybe I wouldn't partner with them, I definitely would partner with them, right? And so you take those lessons and you just carry them forward.
Hi, Scott Lolliger. I work for La Clínica de la Raza in Contra Costa, and this question is for Gustavo. I used to live in Porterville, which is Tulare County, and if I remember, the bad air of Bakersfield and Kern County didn't stop
Can you
at the
speak up
county.
a little bit? I'm sorry.
Can you hear me?
There's a bit of an echo on the stage, so I think the louder voice will.
Can everybody else hear me? Yeah, okay. Anyway, my name's Scott Lolliger. I work for La Clínica de la Raza in Contra Costa, and this is for Gustavo. I understand the bad air of Kern because I used to live in Tulare County where the air didn't stop at the county line. And my question really is directed at, we talk a lot about community engagement, and you're sort of the principal community person on the stage. Can you just sort of tell us how you built your community, particularly in a community like Kern County or Tulare where there are a lot of farm workers living in a lot of scattered elements and may or may not be part of community programs? How did you start, and what are the principles of your community that you're continuing trying to foster?
I appreciate the question so much. There's a basis that a lot of us really carry that were funded or founded by folks before us, and they're called the Principles of Environmental Justice. And you can find those at ejnet.org as a consortium of good information. But how do you build community? That's an awesome question. I have the privilege of coming from the farm worker justice movement. My father and grandfather and uncles all worked with Cesar Chavez and the United Farm Workers. My father retired as one of the national vice presidents of the UFW. So my weekends were picket lining Vaughn's and Ralph's and going from Salinas to Bakersfield to Coachella. And so that was just the environment I grew up in. And so growing up as a child in the academic world, during, I think it was 2006, during Bush administration, there was a lot of high school walkouts. And one of my friends was like, I dare you to be one of those organizers that walks out your high school, And I was like, let's do it. And so I think it was, it was really like just being exposed to that community, being someone that was always told by my elders, you need to stand up and fight, and you need to stand up and speak. As short, as tall as you may be, you need to be a loud voice. And so, but with that, there is a lot of mistrust, because with farm working communities, there is a whole level of like insecurity of like, am I a citizen? Am I not a citizen? Can I participate in this? Can I not participate in this? And before coming to the California Asthma Collaborative, I've been here for almost 3 years now. For a better part of 10 years, I was with Central California Environmental Justice Network, where we worked with Gina Solomon. Maybe you guys some know her, where we did a research project looking at specifically at farm workers. And this was kind of my start at really focusing, working with farm working communities. And it was like looking at households in the Central Valley that had swamp coolers, and only swamp coolers as a cooling system, and then wrapping those swamp coolers with air filtration devices to see the difference between indoor, outdoor, or indoor and outdoor air quality. And we found that folks that particularly live in mobile homes and homes with swamp coolers had a larger exposure to not only like pesticide and PM 2.5 and VOCs, but also there's a valley spore called valley fever, and it's very prevalent in farm working communities. And those folks that use those filtration devices on them, they were sampled and found that they also had a lot of valley fever in them. So it's really like being in the community before being a director of climate equity and environmental justice, whatever that means. I was a community organizer, and I still am a community organizer. It's a lot of work. I have 3 daughters and a wife, and oftentimes they're like, again, you're leaving? I'm just like, yeah, you guys want to come with me? Let's go. And so I've been exposing my children, and like, they're always like, they ask my kids' school, like, what does your father do? They're like, oh, he fights for clean air. And they're just like, what? We do oil and gas here. What are you talking about? He fights for clean air. And so it really just, it's being in the community is investing a lot of time, a lot of effort, and getting to know the leaders in your community. Oftentimes, there's methods of like going door to door, and that often works. And there's also other methods of like really honing in, investing time in community leaders and letting them do a lot of the like prioritizing of how it should be done. And I think for me, that has been one of my greatest outcomes, is really investing time, energy, resources into community leaders in those communities. So then they could be like, okay, Gus, I don't need you no more. Thank you for your assistance. I'm gonna do my own thing, right? And oftentimes that means bringing more residents to fight against the Valley Air Pollution Control District, CARB, EPA, this administration, and others. So it really is an investment of time, and you have to have your heart into it. And there's a lot of sacrifices that go into this as a community organizer to really uplift those marginalized communities that oftentimes don't have a voice. And so we never speak for people. We echo their concerns. And I think understanding the fundamental essence of particularly farm working communities, what they fear and what they don't fear, and kind of going with using that energy to really grow it. So yeah, I will leave my contact information, and I would love to. We do workshops. My father is an author. He claims to be a farm worker, but he has all this, external education. He wrote a book called The Discipline of an Organizer. And so it talks about how to build community in community. And so I would, invite you to send me an email. We would love to do some workshops together for free.
I feel like you've given us a roadmap for the future, so thanks very much. Before we close out the panel, I just want to see if there's any last-minute thoughts that any of our panelists want to add.
I'll just uplift Gustavo's last words about spending time in community before really starting the research or going on to the project. And so while I'm not a community organizer, as an investigator, we've worked in the Richmond, California community for, I think, 8 years now. And before actually starting the research projects, we met with our partner there. We learned about the clinic and the community that was around there, which is in the Iron Triangle. And then we also worked with them to build out their veggie distribution program, help them apply for grants to the Marin Food Bank, and also in response to just having people be part of our pilot study there was a big interest of the youth that were in the clinic to learn about research. And so meeting that demand, we started a youth participatory action research program. And that program, our YPAR interns are instrumental and have really been the ones that have directed our science going forward in the Richmond community. But that took probably 5 to 6 years before we saw a real, true project that arose from it, and more recently seen funding come from it. And so it's that time, investment, and echoing the concerns of the community and bringing that into the research to really set the priorities.
A huge round of applause for this phenomenal group of people. Thank you for sharing your insights and all of the work that you have been doing over the last few months. I'm going to turn it over quickly to Mike before we go to break.